Hi, I'm Dr. David Greene with PreferredPainCenter.com, where we bring you anything and everything education for pain management. Today I'm out at Squaw Peak, which is a gorgeous mountain area here in central Phoenix. A lot of hiking, a lot of picnics come out here. Not so much today though, it's 110 degrees. So it's pretty, I'm probably the only one dumb enough to come out here on a day so hot. The topic today is residual pain after back surgery. Why does it occur? Well, let's give a scenario. Let's pretend you're somebody who has had back surgery, and this may be actually you, and it went well. And then 6 months later, you start to have more pain in your back and also pain that shoots down one of your legs, maybe both of your legs, okay? Why does that occur, and what can be done about it? Or let's say you've had a successful back surgery, and then 3 years later, your back starts to kill you. What's it all about? There are three main reasons that people have an initially successful back surgery and then it kind of falls apart, so to speak. And the first reason is it may literally fall apart, okay? So if you had a successful back surgery, got a lot of your pain was gone, and then it comes back, well, what could have happened is if you had hardware put into your lumbar spine, the hardware is put in, the screws and the rods, so that it will hold the levels in place until the bones weld together. That's called a spinal fusion. Well, what if the spine doesn't fuse? Or what if 3 levels are fused and only 2 fuse, and the other one still, you know, is basically just being held together by the screws and rods? Aha! If the screws and rods start to get loose, or they break, then your pain can go like this. Because a surgery that really would have failed, but the hardware was keeping it together, all right? And that's called a hardware failure. Even if it's just the screws start to toggle a little bit, get loose, that can lead to increases in pain. So that can be diagnosed with some diagnostic injections of numbing medicine, and also some x-rays can often show that the screws are broken or there's some space there where they're moving around. So that's reason number one. Reason number two is if you had a fusion of, let's say, L4-L5, so one level, L4, L5, weld them together, those levels used to absorb stresses every time you walk, twist, and bend. When you fuse them, they can't absorb any stresses. So those stresses go up or they go down. So your L5-S1 level is going to see more stress than it ever did before. It can accelerate the degeneration of that level, and it can cause what's called adjacent segment degeneration. And you can end up needing pain management treatment for that, which usually is successful, but sometimes it'll necessitate another surgery to include that level above or below in the surgery, and that's called a fusion extension. All right, so that's called adjacent segment degeneration. It is very, very common. In lumbar spine surgery, over 50% of patients within a few years start to have adjacent segment degeneration. But with effective pain management treatments, a lot can avoid needing another operation, okay? Now, the third reason for a failed back surgery is scar tissue. So let's say you have a nerve decompression where you have spinal stenosis at multiple levels, and the surgeon decompresses multiple levels so the nerve roots can get out from the spine, okay? So the nerve root's free. It was being compressed, now it's free. But when you do surgery, there's some dead space there, meaning there's tissue that has nothing in it, and into that void, your body makes scar tissue. You don't want it, you don't need it, but the body sees a void and it fills it with scar tissue. Unfortunately, what can happen is if there's a nerve root sitting there, the scar tissue can envelop that nerve root, and it can start to cause the same type of pain you had before the surgery, such as pain shooting down the leg, sciatica. That's a big problem, because if you go back in and do a decompression to remove the scar tissue, one, you risk damage to that nerve root, and two is, you take scar tissue away, it comes right back. So in the future, there will hopefully be some better substances to make it so that that scar tissue doesn't form to begin with. But right now, the answer is often not to do another surgery to take away the scar tissue, because it's going to come right back. So what is the answer for that? Well, if you have very bad back and radicular or sciatica pain, pain going down the leg, and surgery is not an option, what can you do? I mean, it sucks waking up every day and having really bad back and leg pain, and you have to deal with that all day, every day. There is some help available. A spinal cord stimulator can be a great option to help mask that pain that's shooting down the leg and the back pain. And it's not going to fix the problem, but it can mask it. So isn't that the next best thing, right? Masking a problem that can't be fixed? It is. So Arizona Pain Specialist can help a lot if you've had surgery that was initially successful and then failed. So it's failed back surgery. It falls into the same, term, the bucket there, but it didn't fail to begin with. So nothing else that could be done. They had the right diagnosis, did the right surgery, it just didn't work. Or it worked and then failed. So if it's failed hardware, sure, you might need to get a revision. If it's not, if it's due to scar tissue, or let's say the diagnosis was wrong to begin with and you only got rid of half your pain, pain management is a good option for you. The number is 602-507-6550, and there's a lot of information on our website at preferredpaincenter.com. The link is in the top of the description. I'm Dr. David Greene, preferredpaincenter.com. Your pain stops here.